final question. Why do some people have reactions to the vaccines and some people do not?
For people to know that it's normal to have a reaction, not an anaphylactic reaction, but a reaction to vaccine, because we are putting, first of all, something in a muscle that is not normally there. So your muscle's irritated. And I always tell people it's screaming, do something about this because it's not enjoying it. It's fluid that is not normally there. So move your arm around a lot, no matter how old or young you are. It's going to help. So while you're waiting, because we keep you 15 minutes, do lots of really rolling that shoulder. Then every vaccine has different possible what we call side effects after the vaccine. So, and they're normal. So those for this particular vaccine, it's very normal for people to have flu-like symptoms. We're not giving you the flu, it's your body's immune system. And so that's things like a headache, feeling extra tired, and really tired, people say. They just feel really tired, need a really good nap. If you end up with chills and fever and really achy, you're probably going to end up wanting to curl up in bed for a day or two or a few hours. Depends. Everybody's a little different. And some people might have a sore throat. Some people may end up with diarrhea. We find that in some of the older folks. So there are a variety of symptoms. We give you all this information when you're vaccinated. Every vaccine is a little different what those symptoms might look like, but we tell you which ones are related specifically to COVID. And it is your immune response. That's how your body is responding to the vaccine. If you start to have some other symptoms, which we also let you know about, that are life-threatening, and that's because you may not have known that you were allergic to something in the vaccine, just like you may not know when you eat something new or try a new medication for other reasons. That's when we worry, and that's when we would apply giving you adrenaline. So that's things that might happen in your throat, in particular. You can start to get a rash, but it's really tongue, lips, mouth, throat area that we're very concerned about. And we make a really quick decision on what to do when that's happening. And it's usually within the first 15 minutes of exposure to whatever you're allergic to. So that's why we keep you for the 15 minutes.
I'll just add a couple more comments there. So it's common to have a known mild reaction to any vaccine. So most commonly people might have some redness at the site or soreness. And those are the most common things that happen to most individuals when they get their vaccine. Some people have mentioned when they get their second dose, the side effects are a little more pronounced compared to the first time. But again, they're very, very mild. But again, the risk of the real serious consequences, it's about 1 in a million to 2.5 million for the mRNA vaccines. Can't remember off the top of my head for the other ones. It depends on what particular side effect you're looking at. But the risk of serious side effects is 1 in 1 million, 1 in 2.5 million. It's you're better chance winning the lottery sometimes.
Right.
But the other thing you have to remember is the risk of getting COVID definitely outweigh the risk of side effects. So there's a huge benefit from getting this, preventing getting COVID. And the one thing we got to remember in our population that we are. We're a blue collar province. We're hardworking. We do have some of the older people and even younger people have chronic conditions like high blood pressure, lung disease. The people who smoke or vape. It's really important for them to get vaccinated as well because there's a risk of just having those conditions. You could end up in hospital, so we want to avoid that. Mm-hmm. The last thing I'll say is most of those side effects that Christina commented on are short-lived. They only last for a few days. The one thing to remember when getting your vaccine, it takes about 10 to 14 days for your immune system to turn on. But as you get further and further away from that, your immune system it's like building pumping iron and building muscles. It gets stronger as it gets further out from it. So the one thing to watch out for is that if you do have these fever or aches or other symptoms of like COVID that last longer than 2 or 3 days, then please get tested. Now people think, well, we're vaccinated, we don't have to test anymore, but the vaccines aren't perfect. There's still people who can get it after 1 dose. Very few people can get it after 2 doses. So if you have any side effects after a vaccine and it's lasting more than 2 or 3 days, then contact 811 or contact your healthcare provider, and we really encourage people to get tested because those type of symptoms, side effect symptoms, could be the early signs of COVID. So in our province, we've done a great job of trying to train the population to get tested. So and it's worked out really well. We have some of the highest testing rates in the entire country. So the sooner we test someone to identify it, the sooner we can prevent the spread as well.